With the healthcare system in critical condition, Canada's premiers once again demanding Ottawa step up.
What we're calling for today is just a meeting to sit down with the Prime Minister to have the discussion about a fair and sustainable funding for the future of healthcare in our country.
They met virtually to deliver a unified message.
Set a date. We will put aside our whole schedule, all 13 premiers, to show up to Ottawa and sit down and let's hammer out a deal.
But Ottawa and the premiers disagree on some fundamental points. Provinces and territories say the federal government covers just over 20% of healthcare costs. Ottawa says that ignores tax point transfers that push the federal contribution to roughly a third.
The goal is to have a 50-50 funding partner, and with the transfer of tax points and the cash transfers, they believe that they're at 35%. Then it seems to me that we're about 10 to 15 percentage points off.
The feds say they're open to more spending, but that the premiers shouldn't be crying poor.
We look across Canada, on average, provinces and territories are running surpluses. So if it were dollars, it wouldn't be important to talk to the federal government. They would have all the dollars needed to invest in healthcare.
Making it clear any new money will come with strings attached, another potential sticking point.
A plan to send unconditional transfers to finance ministers is not a health plan.
For now, there's no plan for the Prime Minister to meet with the premiers, but the federal health minister says he's been working with his provincial and territorial counterparts, and behind the scenes there is some common ground. Still, that can hardly be comforting for Canadians who are still facing long waits for care, and doctors and nurses who are overworked and exhausted. Tom Perry, CBC News, Ottawa.